Measure and record a patient's pulse. Introduction. The pulse is the measurement of how many times the heart beats in 1 minute. Gently pressing down on an artery will allow you to feel the wave of blood moving through the artery under your fingers. The heart squeezes and sends a wave of blood through the arteries. That wave pushes the one in front of it, and that one pushes the one in front of it, and so on. You are feeling each one of these waves as they pass under your finger. A normal pulse rate is 60 to 100 beats per minute. It is important to count the heart rate for 1 full minute. When you are counting, you should also pay attention to the strength of the heartbeat. Is it weak or strong? And the rhythm of the heartbeat. Is it regular? Any pulse under 60 or over 100 must be reported to the nurse immediately. If the pulse is not regular or feels weak, the nurse should also be informed. Pulses can be taken at many places in the body, but we are going to be using the radial pulse in the wrist. Place your index and middle finger at the top of the patient's wrist on the thumb side of his hand. Do not use your thumb to take a pulse. Your thumb has an artery, and you will get your own pulse, not your patient's. Lightly press your fingers down onto the artery at the top of the wrist until you feel the pulse. Pressing too hard will pinch the artery off and you won't feel the pulse. Remember, we are feeling for a wave of blood moving through an artery. Placing your thumb on the back of the patient's hand helps stabilize your fingers and will help you feel the pulse better. Putting it all together. This skill, like all other skills we do, starts with the opening, including providing privacy and washing your hands. Telling the patient that this skill will take at least 1 minute helps ensure that they will remain quiet during that time. Keep the patient's elbow supported on the bed to prevent fatigue. The RN evaluator will use the patient's other arm to obtain a pulse while you are performing the skill. This is how the state will evaluate your accuracy. You can be off 4 beats per minute on the pulse from the evaluator's readings and still be considered accurate. The procedure. Find the pulse and pick a starting point on the clock. Say start so the evaluator knows when to start counting. Count the pulse for 1 full minute. At the end of that minute, say stop so the evaluator knows you are finished counting the pulse. This is a documentation skill, so you will need to write down your findings on the documentation sheet the evaluator will give you. This should be done after your closing and final hand washing, so that your pen is not contaminated. You will document the amount of times you felt a pulse under your finger during the minute in the section marked Record Pulse. Pulse is recorded as a measurement per minute. In this example, the pulse was 72 beats per minute. Watch the instructional video on how to perform this skill, then view the demonstration video to see how this skill is performed in a testing environment. Once you are comfortable, try this skill on your own.